Hello everybody, and welcome to today's presentation on Korsakoff syndrome. I am your host, Zachary Shepard, checking in for Psychology 459, and today we will be going over an overview of Korsakoff syndrome, ranging from symptoms and diagnosis to treatment and outcomes. So to start out, an initial overview of Korsakoff syndrome. Korsakoff syndrome is a memory disorder that is characterized by amnesia, ataxia or unsteady movement, abnormal eye movements, and confabulations, which are essentially made-up memories. We'll talk about those more in the symptoms section. Korsakoff syndrome is linked with thiamine or vitamin B1 deficiency, and as a relatively rare disease, this occurs in less than 2% of the world's population. However, it has been getting more notice as of late, and is now at least more understood and more well known than it was a couple decades ago. So what are the causes of Korsakoff syndrome? The biggest cause is thiamine deficiency, and as a pre-note, thiamine deficiency really causes and triggers something called Wernicke's encephalopathy, or Wernicke's episode. Now, an episode of Wernicke's encephalopathy can cause global confusion, unsteadiness, eye movement disturbances, as well as memory loss. And if untreated, the majority of Wernicke's cases result in Korsakoff syndrome, with about 20% of them resulting in death. Now, the reason this is so important is because thiamine is necessary for oxidative metabolism. It is, in fact, a cofactor for both portions of glycolysis and the citric acid cycle. So when you lose thiamine, you get buildups of lactate and glutamate, which results in cell death. Now, this is important because our brains rely on oxidative metabolism, and the areas of the brains that have the highest rate of metabolism will hence be affected most quickly. And we'll talk about that soon, but those are the areas that are crucial for memory function and memory storage. Now, the risk factors for this are alcohol abuse and malnutrition or malabsorption. Now, alcohol abuse is one of the big ones, and the reason for this is that alcohol combustion requires thiamine. So if you have a lot of alcohol, you deplete your thiamine. Additionally, if you have a lot of alcohol, you essentially fill yourself up without much of a caloric, with a high caloric intake that doesn't have nutritional value and doesn't supply vitamin B1. And finally, alcohol can also hinder and damage gastrointestinal cells, which results in fewer thiamine molecules being taken up by your body. And malnutrition and malabsorption also can result in thiamine loss just because you're not getting enough of your vitamins in your body in the first place. This can be seen in cancers, for instance, when during chemotherapy you feel like you're full and you don't eat anything as a result. That can result in malnutrition or different malabsorption diseases, such as colon cancer. Symptomology. So first and foremost for Korsakoff syndrome is amnesia. Primarily this is anterograde amnesia, but there is some retrograde amnesia as well. It depends on the severity of the case. This affects both autobiographical information as well as non-personal information. However, semantic and procedural memory is generally maintained, meaning that if you have Korsakoff syndrome, you most likely can still speak and you still maintain a good enough grasp on language. Now, one of the big characteristics of Korsakoff syndrome is something called confabulations. One of the ways that this has been described is honest lying. And essentially what this is made-up stories to fill your memory gaps. The patient experiences these bouts of amnesia, doesn't have the memory that they can retrieve, and without knowing it, make up a completely false memory, hence honest lying. One last symptom is apathy, generally characterized by a lack of responsiveness or a decrease in self-initiated action. So what brain regions are affected? As mentioned earlier, the brain regions primarily affected start out with areas that have higher rates of metabolism. Two of those are the mammillary bodies and the anterior thalamic nuclei, both of which are implicated in memory function. So as you have thiamine loss, oxidative metabolism starts degrading both of those areas and you start experiencing amnesia. Now, we also have MRI studies that show that there's less medial temporal lobe activity during memory tasks, showing that this whole memory-related center is generally damaged. And we also have diffuse tensor imaging studies that show degradation to the fornix and the uncinate fasciculi. The fornix is important because that is what's connecting our hippocampal regions and the diencephalon, which is crucial for pretty much all of your memory communication. If you start degrading the fornix, you no longer have the hippocampus communicating as well with the rest of the brain, and you have these gaps in your memory. The uncinate fasciculi connects the temporal lobe with the frontal lobe, which means that by degrading this, you have less communication again with your memory centers and your decision-making centers, which can result in the perceived memory losses experienced in Korsakoff patients. So, diagnosis. How do you diagnose Korsakoff syndrome? Primarily through neuropsychological means. Now, the tough thing about this is that Wernicke's encephalopathy, which is the crucial one really to diagnose, has symptoms that are quite similar to alcohol intoxication. If you think about ataxia, unsteady movements, eye movements that might seem disorderly, some confusion, these are not too dissimilar to alcohol intoxication. As such, a common procedure is if you have the disorientation and balance issues that are characteristic of both intoxication as well as Wernicke's episodes, then you just administer a working memory test. And if you have a patient that has the disorientation and balance issues coupled with the working memory issues, you most likely have somebody with Wernicke's. There are studies that currently exist that compare MRI imaging of healthy patients and Korsakoff patients as potential for diagnosing Wernicke's. However, these should not be relied upon. Rather, the neuropsychological testing currently has the most prominence for diagnosing a Wernicke's episode. And through a Wernicke's episode, you can diagnose whether or not somebody has the potential or currently has Korsakoff syndrome as well. For treatment, the first thing is thiamine administration. Again, if you have a Wernicke's episode or Korsakoff syndrome, they've been caused by a depletion of your thiamine stores. So, especially when you have somebody in the midst of a Wernicke's episode, it's most important to start out by giving them thiamine to restore those levels and prevent damage to the mammillary bodies and the thalamic nuclei. However, once you get to long-term cases for Korsakoff syndrome, you start needing to rely more on behavioral interventions as the prime time for thiamine administration has mostly passed. One of them is cognitive intervention, as displayed by new memory techniques. One example of this would be pairing imagery with memory to start coupling different processes of your mind to start bolstering your memory. Another is environmental modification. A good example of this is helping a Korsakoff patient live in a calm, well-structured living environment, and that can start aiding relearning if you have something that's more structured, repetitive, and is not full of surprises. However, the best treatment is obviously prevention. The big one here is refraining from alcohol abuse. If you are chronically misusing alcohol, you are most likely depleting your thiamine stores, and ultimately this will result in damages to your brain. Additionally, if you have any malnourishment or malabsorption issues, again, cancer or perhaps anorexia, checking your thiamine levels is crucial to make sure you have not accidentally depleted your thiamine stores without even realizing it. So what are the outcomes for somebody with Korsakoff syndrome? As mentioned before, 20% of untreated Wernicke's episodes result in death, and 85% of the survivors develop Korsakoff syndrome. For those who have Korsakoff syndrome, it's really a mixed bag. One quarter can recover immediately with really just the thiamine dosage, and another quarter shows no recovery at all. The remaining half can show improvement over time, and again, this is dependent on a few different factors. One of them is alcohol abstinence. Without alcohol abstinence, it's very easy to have recurring Wernicke's episodes. You need to maintain your proper thiamine levels, and alcohol will continue to deplete those. Additionally, depending on the cognitive improvements or environmental modifications, you can continue to help patients show improvement over time, and that can allow for further recovery. Lastly, here are my references. This is page 1, and over here is page 2. Thank you all for listening, and may your masks be forever fixed to your faces.